My name's Adjunct Professor Terry Slevin. I'm Chief Executive Officer of the Public Health Association of Australia. PHAA is a professional association of over 2,000 members of people who work in public health. They might be professors, they might have PhDs, they might be studying for PhDs in various areas of public health. And public health covers a broad turf from tobacco control, issues around obesity, racism, environmental and climate health, Aboriginal and Torres Strait Islander health and much more. So we are very much a policy-focused organisation, and we seek to influence public policy to improve the health of people in Australia. This is a population health screening conference. Everybody knows about breast screen, the breast cancer screening program, cervical cancer screening. They've been around since 1991. We know that the bowel cancer screening program's been going for some years as well, and the Australian government is about to launch lung cancer screening. So cancer screening is something that most people understand. And there's very specific requirements for a successful population screening program, and when it comes to finding disease early in the hope of being able to treat it successfully and reduce mortality from the disease, there's a long history of research and understanding. But a whole range of other health conditions see that as a potential way forward, whether it's cardiovascular disease, diabetes and much more. So what we're doing is looking to firstly ensure that those people who are in what are often silos, whether it's a specific cancer screening program or other fields of health endeavour, ensure they get a chance to learn from each other, learn their experiences about what's successful, what's less successful, identifying potential harms of screening, and we know there is a cost to be paid, not just in dollar terms, people's time, the anxiety associated with doing and waiting for the results of a test. So this conference is about exploring how we can make essentially population screening programs the best possible outcome for the most possible people. Sure, ultimately when you propose the establishment of a population screening program, there's a set of criteria the World Health Organization has set. Is it an important health problem? Are there legitimate and effective tests that identify people who are likely to have the disease versus those who do not? And can we successfully intervene at that early stage? So there's no point giving people information that they're at higher risk of a disease if you can't successfully provide them with a solution to that problem. Otherwise, all you do is increase anxiety and make people powerless. So ultimately, this is about all of the health problems where we're considering or have established screening programs and finding ways of making the existing ones better and improving the way in which the research drives the prospect of new screening initiatives being introduced. Type 1 diabetes was one of the ones we discussed this morning, and there are many more, whether it's monitoring with regard to childhood obesity. We talked about the current evidence doesn't support the introduction, for example, of prostate cancer screening. So this is a range of complex and in many cases interrelated challenges and how the health system can get some benefit from this early detection, but also ensure that we reduce to the greatest possible extent the degree in which these kind of programs can generate anxiety, harm, helplessness and other drawbacks that inevitably go with a lot of these programs. Yeah. Public Health Association has a peer-reviewed journal, the Australian New Zealand Journal of Public Health. We've got a number of researchers presenting their work, the evidence of research they've undertaken that's screening related. There's a session going on as I speak, and there's 4 rooms going where various topics of relevance to screening are being presented in a peer-reviewed environment. Out of that, we hope those people will proceed to publish their paper, whether it's in our journal or other journals. So contributing to the science is a fundamental tenet of the way we conduct our work. Our policy work has to be drawn from evidence, and that evidence is generated by reputable researchers, and they expose their ideas and their research to their peers to ensure that it meets high scientific standards. So that's that scientific process. With regard to PHAA, we have a number of tools to communicate with our members and beyond. So we have regular internal communication to our membership. We also have a blog where we put up topics of relevance. We also look to ensure that the evidence that's available is funnelled into decision making at governments, whether it's at state and territory level or national level. So we contribute to government inquiries through our position statements, through providing evidence and submissions on an ongoing basis. So we're very active in trying to ensure that the highest possible standard of evidence influences decision making and resource allocation so as to improve the outcomes for people living in Australia.